This is mini lecture 3A. In this unit, Unit 3, we'll be looking at communication in the healthcare setting, and we'll begin with Chapter 15, the patient as an individual. It's important to look at our patients as individuals because their well-being is affected by our attitudes, concern, and of course our skills. Individuals are incredibly complex. They are influenced by culture, by personal experiences, and by, of course, basic human needs. There is a philosophy that's important for you to recognize called the philosophy of individual worth. And it says that every human being has worth. When we apply this in healthcare, what it means is that we have to give the same level of care regardless of that patient's circumstances. Some patients are more difficult than others. They may be experiencing pain, they may be anxious. There are many patients that are challenging, but we need to show empathy and we need to give them the best care possible regardless of how they present. It's also important to recognize that all of us have prejudices, which means that we prejudge. Prejudices are these negative feelings, these prejudgments, sometimes called bias, and it does prevent us from seeing people as unique individuals. We have to identify our prejudice so that we can then deal with them. Many of these are incorporated in our belief systems, and we take them for granted, and we often don't see them. Implicit bias is the bias that is outside of our consciousness. So we don't see it, we don't identify it, and therefore it's difficult for us to overcome. In healthcare, what we know is that there's extensive implicit bias, and this affects patient outcomes. Almost everyone has prejudices of some type. Absolutely true. We're possibly unaware of them, but almost all people have prejudices. So how do we overcome bias? We need to first recognize the prejudices we have, how we prejudge people. We need to examine how we react to others. And we need to imagine those that we might prejudge or stereotype. We need to imagine them as opposite or outside of that stereotype. Try to see them as individuals. And of course, practicing empathy is extremely important. It's also helpful to associate with people from different groups and to always create interactions, reframe them as interactions between equals. You don't have to agree with all the beliefs of others, especially if they're harmful to their health, but we need to understand or show empathy. When we're looking at the patient as an individual, we also have to understand what culture is. Culture describes the values, beliefs, social organization, family structure, language of a specific group. It can include religion, everyday activities, economic status, and sexual orientation as well. Culture is important. It provides guidelines for behavior, gives our lives some predictability, and enables us to live together in harmony. There is typically a dominant culture in an area or in a country, and it is accepted as the foundational beliefs and behavior of that society or country. So in the US, as part of the United States culture, we value efficiency, we value being on time, we value, until the pandemic, having a firm handshake, looking someone straight in the eyes. All of that is part of the dominant culture. But our population has become increasingly diverse. Groups that were once considered to be minorities, some of them are no longer considered minorities. And the demographics of our country are changing. We need to recognize differences, but of course, never make assumptions, again, based on stereotypes. So, as a healthcare provider working with people from different cultures, first of all, appreciate different approaches to life. This is what makes life so interesting. Learn about the cultures of the patients that you work with. Okay, avoid assuming that patients always understand you or even agree with you. And remember that you may learn about a cultural group, but you cannot assume that everyone in that culture practices the customs that you learned were associated with that group. So you need to be sensitive to possible cultural differences. You need to ask questions to learn more about your patients and recognize that there are many subgroups within a culture. So some examples of cultural differences include personal space, how far away we sit or stand when we're having a conversation. In the United States, it's about 18 to 24 inches, but it's closer in some cultures, farther away in others. How we use touch varies greatly. This is very interesting from culture to culture as well. The answer to that is 18 inches. Should we assume that a patient with a long dress and a head covering is a Muslim? Never assume. Okay, ask questions sensitively. Direct eye contact is a sign of sincerity for most cultural groups. That's actually false. It's a sign of sincerity in dominant U.S. culture, but for many cultural groups is considered rude or aggressive. So as we learn more about individuals, we can also appreciate different attitudes, different philosophies around medicine. Traditional Western medicine is practiced by most United States physicians, and it focuses on physical aspects of the body. It employs scientific method, and it attributes illness to factors that we can measure and explain. But there are cultural variations, not only in philosophies around health and health care, but in the definition of health. Health can be described as an absence of disease, but it also can be described as a balance of body energy, a harmony with nature, or an integration of body, mind, and spirit. The sources of good health may be viewed differently from culture to culture. Perhaps it's good food, good hygiene. Perhaps it's a gift from ancestors, a blessing, the will of God, or reward, or even a sign of good luck. It can be described when we're looking at illness as an imbalance, as demons, punishment, microbes, the impact of microbes, or the will of God. So again, both our view of health and illness can differ depending upon our culture, and so can treatment methods. So we are now hearing more about acupuncture. Although this is traditionally an Eastern style of treatment, we, of course, in Western medicine depend heavily on drugs, prayer, surgery, lifestyle changes, rituals, ceremonies. All of these are treatment methods that are used in different cultures. Religion becomes important in health. Religious and spiritual beliefs influence many healthcare practices. As you learn more about health and culture, you might happen upon shamans, faith, healing, and prayer, illness as punishment, as I mentioned, prayer, and of course, evil eye as well. We are beginning to appreciate harmony as part of wellness, and harmony is the balance of body, mind, and spirit. It's the basic belief of many cultures, especially the Chinese concept of yin and yang, but also a traditional Hispanic belief which relies on the body humor theory, and you can see that here. It is also a balance philosophy, but it employs 4 fluids that control the body. Tai Chi is a form of acupuncture. No, that is false. Tai Chi is a form of Chinese martial arts, and it's very good for balance, for strength, for coordination. It decreases falls in older people who practice it. When we talk about treatment, another type of alternative or complementary medicine includes herbs and plant medicines, and there is growing interest in this, and it's important to take note that these substances are not controlled by the FDA, the Food and Drug Administration, and they can be harmful, but some can also be helpful. So it's important that you do your research and look to a reliable source in that research. On to the response.